Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you're new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my previous videos. We are back with non-pharmacological management technique part 5. So the first technique of this video is use of poetry and drawings. In pediatric dentistry, use of poetry and use of drawings are creative forms of cognitive reframing and active participation. These techniques moves the child from a passive victim of a medical procedure to an active creator in a safe environment. Here, cognitive reframing, also known as cognitive restructuring, so it is a psychological technique used to change a child's perception of a situation from threatening to manageable or positive. So use of poetry in children age 7 or above 7 years. This is a collaborative linguistic exercise. By co-authoring a poem, the dentist and child engage in a process called guided discovery. The psychological hook is children over 7 years are in Piaget's concrete operational stage. They enjoy wordplay and logical connections. Then rhyme and rhythm. The predictable cadence of a poem provides a sense of order and security. The discovery mechanism, as you noted, when a child completes the rhyme, for example, teeth stay long when they are strong. They aren't just reciting a rule, they are owning the information, and this increases self efficacy. Then, use of drawings in children age 3 to 5 years. For preschoolers, the world is understood through anthropomorphism. Anthropomorphism is a technique of giving human like characteristics, emotions, or intentions to non human objects such as the dental tools or teeth. Projective play. Drawing allows a child to project their feelings onto paper. Transforming a tooth into a pet like a cat or a ladybug shifts the tooth from an anatomical object that might hurt to a friend that needs protection, which develop the empathy. Once the tooth is a pet, the child's motivation for hygiene changes from avoiding punishment to nurturing a friend. Some supporting research and articles. So, art therapy in medical settings. Research by Rollins in 2005 in pediatrics suggests that therapeutic play like drawing significantly reduce the heart rate and respiratory rate of children in clinical environments. The power of rhyme. Studies in educational psychology by Goswami in 1990 show that rhyming improves memory retention. In dentistry, this means the child is more likely to remember the strong long rule at home because it was stored as a rhythmic memory. So here strong long rule is a mnemonic technique used to teach the children and parents how to effectively use fluoride toothpaste to protect their teeth. So strong is for use fluoride toothpaste in correct ppm which strong the enamel, and long means brush for 2 minutes long enough and don't rinse. Modern validation in 2022, a study in the International Journal of Clinical Pediatric Dentistry explored the use of creative distractions and found that children who engaged in drawing or storytelling had significantly lowered the modified child dental anxiety scale scores compared to those who only received verbal instructions. Advantages are repetition without monotony, which leads to neural encoding. Multiple exposures to a message like hygiene in a different format strengthen memory. Sense of achievement, which leads to self efficacy. Small wins build the child's confidence to face bigger challenges like injections. Destroying preconceptions leads to cognitive reframing, replacing an old threat memory with a new fun experience. The next is hypnosis. Hypnosis in a pediatric dentistry is a sophisticated psychological state characterized by focused attention and heightened suggestibility. Far from the stage magic stereotypes, the clinical hypnosis is a legitimate neurophysiological state where the brain bypasses the critical filter of the conscious mind to accept therapeutic suggestions. The physiological state of hypnosis. When a child hypnotized, they enter the state of dissociate awareness. So, dissociate awareness is a mental state where you are physically present in one place but your mind is fully detached, focused elsewhere. Let's understand how. So, functional MRI studies show a decrease in activity in the anterior cingulate cortex, which is responsible for error monitoring and logical analysis. The result is the child become less analytical. For example, they stop thinking is that a needle or what, and more experimental. For example, they believe the dentist when they say you are floating on a warm cloud. Now let's see the clinical techniques step by step. First is induction, the entry. The goal is to move from a wild field of vision to a single point of focus. Let's see how. The first is visual or sensory stimulus. By asking a child to stare a light or a focus on the feeling of their hand becoming heavy, the dentist tires out the conscious mind. Then instructional coupling. Using phrases like with every breath you feel more relaxed links a natural automatic body function like breathing with a desired state like relaxation. This is a form of classical conditioning. Then second is deepening, building the state. Deepening ensures the child doesn't snap out of it if they hear a loud noise. By shifting modalities from imagining a sound to feeling a temperature, the dentist anchors the trance in a multiple parts of the brain. Then post hypnotic suggestions, the long term fix. This is the most powerful part of retraining fearful patients. The dentist sets a suggestion for future. Next time you sit in the chair, you will immediately feel that same heavy sleepy feeling. This creates a conditioned relaxed response for future visits. Let's see scientific explanation of pain and anxiety control by hypnosis. So, hypnotic analgesia. Hypnosis can actually alter the way the brain perceives pain. It doesn't necessarily stop the nerve from firing, but it changes how the somatosensory cortex interprets the signal. First is gate control. Hypnotic suggestions can close the gate in the spinal cord, preventing pain signals from reaching the thalamus. Blood flow control. Some research suggests hypnosis can even influence local blood flow. It can create vasoconstriction, which is why it is occasionally used to control bleeding in minor oral surgeries. Then eliminating defense mechanism. So anxious children use stalling tactics like asking for water, bathroom breaks. Hypnosis bypasses this ego defense by focusing the child so deeply on their internal imagery that the need to stall disappears. Let's see some supporting research and scientific articles. The foundation, Hannon in 1995 put a foundation of this technique. Hannon's work established the framework for using hypnosis to treat psychosomatic gagging and parafunctional habits like thumb sucking in children, noting that children are the best subjects because of their natural imaginative capacity. Fimonville et al. In 2000, a seminal study in anesthesiology using PET scan showed that hypnosedation, which is hypnosis and local anesthesia, significantly reduced pain and anxiety while lowering the activity in the brain's pain network. Then Wolf et al. In 2016 published the International Journal of Clinical and Experimental Hypnosis. This study found that children aged 6 to 12 showed a significant reduction in dental anxiety and higher tolerance for local anesthetic injections when using hypnotic induction. The absorptive brain. 2023 recent neuropediatric studies suggest that because a child prefrontal cortex is not yet fully developed, they lack the rigid logic of adults, making them naturally more susceptible to hypnotic immersion. Then the next is flooding technique. Flooding is an intensive behavioral modification technique based on principle of extinction. Unlike desensitization, which introduces a child to a scary stimulus slowly, flooding involves exposing the child to the feared situation at maximum intensity until their anxiety response burns out and they realize the danger is not actually harming them. Historically, these has include techniques like hand over mouth or the use of physical restraints like pappus board to prevent the child from escaping the dental treatment. So the core philosophy was preventing the avoidance reward. When a child screams or kicks and the dentist stops the procedure, the child's brain receives a reward. The scary thing stopped. These reinforce the bad behavior. The goal of flooding is to prevent the child from escaping or avoiding the experience, and the result, when the child realizes that their fight or flight responses does not result in escape, that they are not actually being hurt. The anxiety eventually drops due to sensory exhaustion. Flooding relies on two primary psychological and physiological mechanisms. First is inhibition of negative reinforcement. In psychological terms, avoidance is a negative reinforcer. By using physical restraint, the dentist remove the possibility of negative reinforcement. Then the habituation curve. The sympathetic nerve system cannot maintain a peak panic state forever. Eventually, the body runs out of adrenaline and the heart rate must drop. This is called habituation. If the child is kept in the situation long enough, the brain eventually habituates to the stimulus and stops signaling fear. So, the hand over mouth technique involves the dentist placing a hand over the child's mouth to stop screaming while speaking calmly into their ear. And the logic is to break the child's vocal protest so they can hear the dentist instruction. In modern status, home is now considered obsolete and is no longer taught to recommended by American Academy of Pediatric Dentistry due to the risk of psychological trauma and legal or ethical concerns. And physical restraints like protective stabilization, this involves using a papoose board or manually holding by staffs or parents. And the logic is it ensures the safety of the child during a necessary medical procedure, like preventing them from grabbing sharp tools or moving during an extraction. Modern status used only as a last resort with a strict informed consent from parents. Some supporting research and ethical shift. So ethical pivot from 2000 to present, research by Newton et al. In 2003 and subsequent studies in the Journal of American Dental Association have shown that while flooding or restraint works to complete the task, it often leads to the long-term dental phobia and PTSD-like symptoms in the children. PTSD means post-traumatic stress disorder. The locus of control. 2015 to 2023, modern pediatric research emphasized that children who feel they have zero control are more likely to be uncooperative as adults. And scientific article reference, the use of protective stabilization for pediatric dental patients from APD reference manual. This document outlines that behavior management has moved towards communication and pharmacological like sedation options rather than flooding because the latter can damage the doctor patient relationship. So, today, flooding is largely replaced by retraining or pharmacological management, which use nitrous oxide or general anesthesia. The meaning of this shift is that modern dentistry prioritizes the psychological health of the child over the efficiency of finishing the procedure through force. Next technique is hand over mouth exercise. The hand over mouth exercise, historically referred as aversive conditioning or emotional surprise therapy. So, emotional surprise therapy term focuses on the element of shock. The goal is to snap the child out of a historical loop by doing something totally unexpected. The mechanism behind it is when a child is having a full blown tantrum, their brain is locked in an emotional cycle. The sudden physical act of hand being placed over mouth creates a surprise that focuses the brain to pause and shift focus from emotion to sensory input. And the result is this brief moment of silence gives the dentist a window to communicate instruction while the child is still processing the surprise. While it was once a standard tool for managing hysterical or defiant children, so a hysterical child who has lost all emotional control, they are crying uncontrollably, gasping for air, and are often shaking or sweating. And defiant children are capable of understanding instructions but chooses not to follow them to avoid the procedure. It has largely been removed from the modern clinical practice due to ethical, psychological, and legal concerns. The objective of home was not to punish but redirect attention. When a child is in a state of hysterical crying, they are physically unable to process the verbal instruction. The sensory reset. By placing a hand or towel over the mouth, the dentist creates a sudden, unexpected change in the child's sensory environment. Stopping the feedback loop, crying often escalates because the children hears their own distress. By muffling the sound and gently restricting the vocalization, the dentist forces the child to quiet down enough to hear the clinician's calm voice. Home is technically a form of aversive conditioning or negative reinforcement. Let's understand these as a negative reinforcement. The hand is the aversive stimulus. The dentist tells the child, I will take my hand away when you stop kicking or screaming. When the child complies, the punishment, which is the hand, is removed. This teaches the child that cooperation is the only way to end the uncomfortable situation. Extinction of avoidance. In behavioral psychology, avoidance, like screaming to get the dentist to stop, is learned behavior. Home prevents the success of this avoidance, theoretically leading to the extinction of the defiant behavior. Let's see the shift in clinical research and opinion. In 1970, this technique was used 80% of the time. In the mid 20th century, home was viewed as a necessary tool to ensure child safety and completion of treatment. In modern era, 60 to 79% rejection. As cited in the Newton and Patel in 2004 study, the majority of specialists now believe home should never be used. The psychological sequel. Research indicates that children who undergo home are significantly more likely to develop dental phobia, which is odontophobia, as adults. The compliance gain in the chair is often temporary and achieved at the cost of child's trust in the medical profession. Now, variation and legal risk. The variations of the technique carry different level of risk. Home, hand over mouth, primarily focused on noise and vocalization control. Humor, hand over mouth airway restricted. This involves covering the nose and mouth. This is highly dangerous and largely illegal. It carries the risk of hypoxia and it classified as objectionable in a court of law. Legal status. Today, American Academy of Pediatric Dentistry has officially removed home from its guidelines for behavior management. Using it without explicit documented parental consent and often even with it can result in charges of battery or child abuse in many jurisdictions. Why home is obsolete? In the 21st century, the objectives of home, which is safety, attention, and communication, are now achieved through safer, more ethical alternatives, which are nitrous oxide, protective stabilization, and advanced communication techniques like telshodo, voice control, and distraction. The last technique is protective stabilization. Protective stabilization, formerly known as a physical restraint, is the intentional restriction of a patient's movement to allow for safe delivery of dental treatment. As you noted, the terminology shifted from restraint to stabilization to reflect a medical philosophy focused on safety and support rather than punishment or convenience. The goal is to prevent the flailing or combative movements that could lead to accidental injury from sharp dental instruments. The safety net concept. It is often explained to parents as a seat belt for the dental chair. Duration. It is intended to be temporary. The goal is to finish the active part of the treatment, like an extraction or a filling, as quickly as possible so the patient can be released. Different stabilization aids. First is mouth stabilization, the mouth prop. These are crucial for preventing accidental biting of the dentist and ensuring the child's airway remains visible. Mold mouth prop, a metal ratcheted device. While effective for long procedure, it carries the risk of luxation of a primary teeth if opened too wide or placed on loose baby teeth. Then bite blocks, rubber wedges that are more comfortable but require a safety string like floss to prevent aspiration if they slip. Then tongue blades. These can be used directly to open mouth. It has a durable foam core on the outside of the tongue depressor. It is also easy to use, durable, and available in two size. Finger guards used directly to open mouth. Then second is body or extremity stabilization, papoose board, a rigid board with velcro straps. It provides the highest level of immobilization. Then paddy wrap, so it is a breathable mesh alternative. The mesh is scientifically superior for long procedure because it prevents hypothermia, a common side effect of struggling against restraints. Then beanbag chairs, these are excellent for neuromuscular disorders like cerebral palsy. Instead of fighting the patient's septic movements, the beanbag cradles the body, providing sensory feedback that often naturally reduce spasm. Then triangular sheet. Mink described this technique using a triangular sheet to control an extremely resistant child mild. It allows the patient to upright during radiographic examination. Its disadvantages include the frequent need for straps to maintain patient's position in the chair, the difficulty of its use on small patients, and the possibility of airway impingement. Hyperthermia may be another problem during long periods of immobilization. The need for constant supervision is emphasized so that these problems may be avoided. These are the main reference. Other than these, specific article references are already mentioned in that particular technique, so you can cite them also. This was the last part of non-pharmacological behavior management techniques. In next part, we will cover the most important theoretically and practically also, conscious sedation. And if you want these or any other PDF, don't forget to like, share and subscribe the channel and comment the name of the topic and email ID. Thank you.